Hello everyone, this is Brittany Doherty, and today we are going to be discussing how advanced practice nurses can improve secondary stroke prevention. A little bit about the history of a stroke. There are two kinds of stroke. The first one is a hemorrhagic stroke that is caused by a bleed, and the second, more common of the two, is an ischemic stroke, typically caused from a clot. Stroke is the fifth leading cause of death in the United States. Those people that do survive a stroke are typically left with moderate to severe disabilities. In fact, about 40% of those that suffer a stroke have these disabilities requiring long-term care or even long-term disability, which can negatively impact the healthcare system as we know it. About 25% of the 795,000 strokes that occur annually are recurrent or the person's second event. By the year 2032, the rate of morbidity and death due to stroke could in fact double. And this is certainly related to the baby boomers aging, and there becoming a larger population of people that are at risk for stroke. Therefore, there is a need for aggressive improvement in the management of secondary stroke prevention. So why is this important? Nurse practitioners can facilitate follow-up appointments to manage risk factors, provide educational material that the patient can understand and relate to, and promote active participation in one's own care. These professionals are ultimately responsible for providing important preventative health information and medical management after someone has suffered a stroke. It's also well known that if patients are able to control, especially the modifiable risk factors, the likelihood of them having another event is significantly decreased. Nurse practitioners can really focus and tailor their plan of care to each patient individually. If a patient comes into the office and they've suffered a stroke and they have visual or cognitive or physical deficits, the nurse practitioner should be able to work with that person on lifestyle modifications, work with them on positive behavioral changes, and of course always reiterating the importance of medication compliance. How does this topic apply in nursing? Considering there have been no changes in stroke reoccurrence rate over the past 20 years, there is a need to really focus on what is going on. The patients are having TIAs or strokes, going into the hospital, being inundated with a lot of tests, procedures, information, new medications, and then discharged with a packet of information about the things that they need to do, the meds they need to take, and the people they need to follow up with. It appears that there is a need, especially for a nurse practitioner, to fill this void that remains. It also appears that there is a general lack of awareness about the risk factors attributed to a stroke, and even what the signs and symptoms of a stroke are. About 5 million Americans reportedly had signs and symptoms of a TIA but did not seek any medical attention. Working in the stroke unit, it has been very obvious that people have said, a couple weeks ago I had this funny feeling in my arm. It felt weaker, but the day before I worked really hard and I must have lifted something heavy and pulled a muscle. But after a couple hours it went away. And now, a couple weeks later they're in the hospital with an acute severe stroke. So educating the population on the things that they need to look for is really important. Nurse practitioners can play a pivotal role in the secondary stroke prevention by managing the care of these stroke victims immediately after discharge from the hospital. There are multiple methods in the literature that have shown to be effective in this patient population. The first that I'm going to discuss is motivational interviewing. This is a technique that a nurse practitioner or healthcare professional can use, and it really focuses on a structured, patient-focused, and it's even cost-effective method utilizing behavior modification techniques. This has been shown to improve medication adherence. Another technique is the PROTECT project. This was taken from the University of California in Los Angeles Medical Center. It was a year-long follow-up program for stroke patients to better coordinate prevention strategies, educational interventions, and continued involvement with the primary care provider. Another technique is behavior modification, which I'll get into a little bit more when I talk about the conceptual framework. Another technique that is very basic and simple to use is a post-stroke checklist. This was actually developed by an international multidisciplinary team of stroke experts for improving long-term stroke management. It basically contains 11 questions that really help support and direct clinicians in identifying post-stroke variables that need intervention. And finally, risk stratification involves a stratified care model in the management of stroke to better target aggressive therapy to those patients at greatest risk for reoccurrence of a stroke. So how does this topic apply towards my specific career trajectory? And why would it be beneficial to have a nurse practitioner in a neurology group? Well, it is very apparent that these people are very vulnerable and they are at great risk for having future events within that first year after their first stroke. So having a nurse practitioner actively involved in their care and improving health promotion, education, and giving them preventative options can really impact their future. The nurse practitioner can utilize something called Life Simple 7 metrics, which really focuses on the top 7 modifiable risk factors for stroke patients. They include blood pressure, cholesterol, glucose, staying active, stopping smoking, diet, and BMI control. Following up on these patients' medications, those risk factors, and continually providing education can improve their outcomes. This is an opportunity for the nurse practitioner to find out if the patient is having any side effects to the medications they were prescribed after discharge, or are they having any financial restraints? Were they given a prescription for Plavix, but unfortunately their insurance doesn't cover it, so they just decided to not take it? Or is it an education thing? They were given a prescription for Lipitor. When they went to go pick up the Lipitor, they either read on the bottle or the label or researched it, and they found that Lipitor is commonly used for high cholesterol. But now they're confused because they were told in the hospital that they actually didn't have high cholesterol. So instead of asking or having someone follow up with them immediately and tell them that patients after a stroke are prescribed a statin because it has been shown to have a healing effect on the brain that was impacted from that stroke. These are all important variables that can be impacted with a nurse practitioner. So what exactly is the current issue going on here? As we discussed, the aging population does pose a significant risk on the healthcare system. Improving secondary stroke prevention will not only save lives, but it will also decrease the rate of disability and the tremendous costs that are associated with long-term care. Preventing and managing post-stroke complications achieve better outcomes when there is a multidisciplinary approach. Stroke reoccurrence is high within the first year following the initial stroke. Improving prevention strategies for better comprehensive management can actually reduce secondary strokes by up to 80%. So educating and managing these patients effectively needs to begin right away. The nurse practitioner can collaborate with this person's primary care. If they were found to have new onset AFib, the nurse practitioner can actively collaborate with a cardiologist. If they were found to have a hemoglobin A1C of 10.5, they can collaborate with an endocrinologist. The nurse practitioner can really tailor each plan of care to these patients individually. They can set achievable goals. For example, if they were discharged from the hospital with dysphagia, so they're on a modified puree diet with nectar-thick liquids, the nurse practitioner can make sure that they're being seen by a speech therapist in the outpatient setting to continue to try and advance their diet back to regular food, thin liquids. If they're having difficulty still moving their right arm because it was originally flaccid when they first had their event, the nurse practitioner can make sure that they are still actively participating with physical and occupational therapy to help get back to their baseline. The health belief model was the conceptual framework chosen for this project. A little bit about the history of this model. It basically helped predict compliance with preventative health behaviors for a specific disease. So this really did encompass all that this project was focused on, especially with secondary stroke prevention. Ineffective or unsuccessful prevention is typically due to a lack of understanding about the risk factors. So the health belief model has 4 perceptions, the first of which is one's perception of susceptibility, or one's assessment of his or her chance of actually getting the disease, or in this case, having another stroke. Do they think that they could actually have another stroke, or do they believe that it already happened to me? What are the chances it's going to happen again? What are one's perception on the benefits? So if an individual has made some lifestyle modifications and changed towards a new behavior, for example, if they quit smoking, do they truly believe that quitting smoking is going to decrease their risk of having another stroke? What are one's perceptions on the barriers? So what is someone's opinion on what's going to stop them from adopting the new behavior? So do they think that if they quit smoking, they're still going to have a stroke anyway, so why bother quitting smoking? And what is one's perception of the seriousness of the disease? Do they really think that having a stroke is a serious event? Maybe they just had a TIA and they are very fortunate and have no deficits whatsoever. Or maybe they did suffer from a significant CVA, but they were given TPA and miraculously they, again, don't have any deficits. So maybe they don't think that they need to make any lifestyle modifications or take their medications because they don't believe that this could happen to them again.